Alright everyone, settle in. Today we are going to spend some time reviewing a very helpful chart comparing two important chromosomal conditions, Turner syndrome and Klinefelter syndrome. Think of this as a concise refresher, perfect before an exam. Let's take it section by section, starting with Turner syndrome on the left side of our chart. You'll see it's titled Turner syndrome 45X0, sometimes written as 45XO. The main concept here, visually represented by that chromosome diagram showing only one X, is monosomy X, having just one X chromosome in females. This leads to a phenotypic female who is particularly notable for having no bar body and often experiencing hypergonadotropic hypogonadism. Looking further into the genetics, the karyotype is typically 45X, although mosaicism 45X/46XX is common. There's also the loss of the SHOX gene, which directly leads to short stature. A key point to remember here: if any Y chromosome material is present in a female with Turner syndrome, there's a significant risk of gonadoblastoma. Moving on to clinical features, keep that diagram of the short girl in mind. They typically have short stature. The chart highlights GHI, growth hormone insufficiency. You might also see a short fourth metacarpal and delayed puberty. Gonadal features are very significant: streak ovaries, fibrous, which leads to primary amenorrhea and ultimately infertility. Think of the visual with the diagram showing streak ovaries. The cardiac section is marked very high yield, so pay close attention here. This diagram shows a heart with specific defects. Look for coarctation of aorta and bicuspid aortic valve. This is a common exam question. And finally, under renal, note the specific term horseshoe kidney as shown in the diagram, a common association to keep straight. Now, that little formula in the box down here is perfect for synthesis. Short girl plus streak ovaries plus coarctation equals Turner. And that mnemonic underneath, Turner equals turned off ovary, is simple but effectively reminds us about ovarian function.